And what we would like to do this evening is have a kind of a conversation amongst ourselves to talk to you about who we are and what we do, and several of the things that we've been doing during the year and how we do them, and answer questions that you may have. First of all, for those of you that may have just joined our Developmental Pathways family, I thought it would be kind of interesting for you to know that we are a community center board and that we have been in existence since 1964. So we've been around for about 52 years. We're a private nonprofit, and we're not really an extension of the state. We contract with the state. And sometimes that gets a little bit confusing. So we do a lot more things than what our contract with the state calls for us to do. So that's really something that we like to keep in mind and think that is important for you to hear from us as well. What you probably saw on your screen to begin with was how you can submit questions to begin with. The questions, you'll see a Q&A at the top left of your screen. You'll see a box pop up, and you can type a question in that box. Periodically during the evening, this will show up on your screen. If you forget how to do that, or you need to be reminded, it will come back to you. So have no fear, you can still submit your question at any time during the evening. If we don't get to all the questions this evening, we will have the questions that were not answered on our website at a later date, along with this presentation taped. All right, let's move on. Okay, let's talk about what we do. You can see from the slide that's on your screen right now, we actually are, as I indicated to you, a community center board. There are 20 of the community center boards in the state. We happen to be, because of our area of service, which is Arapahoe County, Douglas County, and the whole city of Aurora, the largest community center board in the state. We are serving 7,000 individuals with developmental delays and disabilities. So from your slide, you can see the breakdown of the individuals that we're serving from birth to end of life is 43% in early intervention, 37% on our Medicaid waivers, and those break down as children's extensive support, children with autism, supported living services, and developmental disability, DD. So a lot of times what you'll hear is CES, CWA, SLS, and DD. I know if you're just coming into the services, all of these acronyms can be really confusing. And believe me, even if you've worked in it for a while, it's still confusing because there is just a plethora of those acronyms out there. To complete this graph, you'll see that there's 16% family support programs. And then one of our new programs that we put together in 2012 is community outreach, and that's 4%. Community outreach was really put together with the intent of trying to reach as many in the community that were not really receiving any type of funding from all of those Medicaid waivers that I just talked about, that we and the board of directors really felt it was very important that we started reaching out and helping families and individuals in some way, shape, or form with either some sort of help with therapies or connecting them with other agencies. So we set up community outreach and started to push out as much as our mill levy money into the community that we possibly could. What we do. So you heard about our area and how many people that we're serving, those 7,000 people. Well, there are about 26,000 people in the whole state. 7,000 of those individuals are being served by us. If you're doing the math, that's 25% of the state that we're serving within this area. It's quite a few folks that we're talking about. Out of the area that we're talking about, the Denver metro area, we have there are 25 wealthy zip codes in the whole Denver metro area. We have 15 of those wealthy zip codes, and yet of those 7,000 people, we have 4,000 that are in abject poverty. That's well over half of the individuals that we're serving. So I just want to put into perspective the amount of folks that we have coming through our doors that we're talking to on a yearly basis. And if you look at this slide, we're also talking to individuals with 81 different dialects. How do we do that? We're receiving funding from federal, state, and county mill levy, both counties. And we're talking about two very conservative counties, Arapahoe and Douglas County. The citizens in both of those counties saw the value in serving individuals and voted to give us mill levy money. So we receive a mill from both counties, and then we have a great deal of community philanthropy that we depend upon as well. And we do that with about 200 staff with a budget of about $34 million. All right, let's talk a little bit about some of the accomplishments that we've done within our departments. So let's, I know I keep referring to my notes, it's just that I don't want to miss anything. And we have done so many great things that I want to make sure that I hit the high points. So early intervention, you can see from this slide, serves 25%. Now, I talked earlier about the fact that we are the largest and that we are hitting 25% of the total population. Well, that also means that we're hitting 25% of all the children eligible for EI in the state of Colorado. That means, in sheer numbers, our early intervention department enrolled 3,500 infants and toddlers over the last year. And we support, we're providing support to 1,900 each month. But I was told today that our numbers, just our intake on a weekly basis, is starting to peak at 70, 75. So that is just astronomical. I think our largest was 79 in 1 week. So we're really doing a lot of numbers. EI has been developing trainings and working with a variety of specialty teams, and we are being recognized by so many different people. The state is acknowledging us right now in our work in the neonatal systems in the hospitals. And we are doing just amazing work with vision and hearing services in all of our hospitals that we're working with right now. Then I also wanted to tell you that if we are trying to put all of our numbers in perspective, the amount of children, and particularly the babies that we're treating, we're seeing more than twice, and sometimes 2.5 times the amount of babies compared to the next available CCB within the area. So you can see we're really seeing a lot of babies and toddlers. Community outreach, which I indicated to you, is really just an invaluable area of outreach to our community. Throughout 2016, provided, looking at this slide, support to 1,626 people. Their newsletter goes out to 3,300 individuals, schools, community agencies, and businesses. And they made over 1,100 community contacts and built 168 new community relationships and 74 community organization relationships as well. And we're supported by those community organizations. They were first, as I indicated earlier, put together in 2012, and they really have been working hard to reach out into the community. They have put over $2 million directly into supporting eligible families and individuals. They've launched a grant allocation process in conjunction with the initiative projects that we have going right now with respite. We reached out in a focus group situation into our community, and what came back was that we needed respite. We needed to be working with children after the age of 3, so we have a 3+ initiative. We needed transportation, and now we're working within the community with all those. Our community spoke, and we listened, and we reached out and continued to do that in our community. Many projects and events benefited on the basis of the fact that we have volunteers working to, and over the past year, up to 1,200 hours in the community just for members in the community. So, moving on, accomplishments of case management. I'm really happy to report that we have eliminated the CES, Children's Extensive Services, and SLS waiting lists in our counties, SLS, Supported Living Services in our counties. It's really a wonderful thing that we're talking about here, and I'm sure any family members that have tuned in would be the first to admit that as well. Over the last several years, we have enrolled more than 1,000 new persons in the Medicaid waiver services. We made a strategic decision to dedicate our resources to getting as many persons enrolled as quickly as we could. And the reason I will tell you we did that is because we don't know how long that money will last. I just want to put that in the back of everyone's mind. Our case management department's annual survey of client satisfaction historically has a 90% positive approval response. That really is, and you can see from this slide, and I won't read that to you, that the individuals answering, and we have a high rate of return on our satisfaction survey, all are returning with a really high rate of satisfaction. Consequently, we are serving over 2,000 people in case management. So we're going to pause here and try and answer some of the questions that have come into us this evening. And hopefully others will be coming in as we're talking to you. So one of the questions that came in, and I'm going to read this to you, and then we'll go from there. What will be utilized in the future for individuals who have SLS and cannot get services? And then the question goes on, many agencies are no longer taking SLS supported living services, individuals, since they don't get enough money to serve them and hiring staff and hire staffing. So I think I'm going to pass this question off to Bob, if you don't mind, Bob.
Okay, thanks, Melanie. Once again, I'm Bob Ward. I'm the Vice President over Case Management, and I will take this question. It seems to be my area. Just to start off for folks, please understand that the rates for SLS services and the definitions for service programs are defined by the state. So we aren't setting the rates, and we are not negotiating the rates with providers. And the service definitions about what you get in your particular services are also set by the state. So we have very little leeway in those decisions of how the state wants those things to be handled. That being said, we know that, in fact, in CES and SLS, there are services that people want, but they can't get because the providers are not there to provide those services. And there's three main factors for that at the moment. One is the rates. Secondarily is the volume of new enrollments that Melanie just referenced has really put a crunch on the capacity within the system to provide services. And third is location, about where people in our catchment area are located, and the ability to find providers, especially in the southern part of Douglas County and not the main metro areas. As part of our CCB function, we have done extensive analysis in looking at what services are people wanting but they're not getting, and where are those services missing on a geographical kind of scale. So we are working with our PASAs and our other service providers, as well as people who want to come into the field monthly, to work with them to develop the capacity to get these services to the people in the manner they desire and in the amount they desire. But it's an ongoing project, and it's a problem not only for us, but for, frankly, all the CCBs across the state and certainly in the metro area. One area that may offer some relief in the coming months is that the long anticipated and often delayed CDOS program, actually not a program, method of delivery, which is consumer directed attended services and supports, is scheduled to go into effect at the end of the summer. And what that will do will be allowing families to hire family members, friends, people they know to provide services. And we're hoping that some relief may come from that. That being said, that the program has been in the works for several years. It's been delayed for several years. The latest we've heard is that they are hoping for implementation at the end of the summer. So hopefully there will be some relief when that program goes into effect. With that said, I'll pass it back to you, Melanie, because I know you're working on provider rates in general at the state.
We are. It's a very difficult issue with provider rates at the state. It seems like every time that we talk about provider rates at the state, it comes up that we have to either study that, or someone is not prepared to really jump in at this time. The legislature is not prepared to talk about it, or they point to trying to regulate provider rates across the state, comparing us to others that are within the system. Wouldn't you say, Matt, as well?
Absolutely.
So, gosh, I think the answer to this question goes across so many different boundaries when you start thinking about transportation everything, the boundaries of our area. I think you answered it really well. Thank you. Okay, let's answer at least another question. Any chance residential services or comprehensive services will be available in the future? And then, if you don't mind, we're going to tag another one of the questions onto this one. But let me just say to this one, this is kind of a crystal ball question, if I could say to whoever asked this question. Thank you for the question to begin with, and thank everyone who's sending in questions this evening. If you've heard us talk about case management, and we talked about CES and children with autism, each one of those waivers kind of has a price tag associated with it. So let me just talk about the high end of each one of those. So if a child is in services with us for CES, the average or the high end of that is almost $38,000 for the high end of CES for a child in service. So if it's CWA, a child with autism, that's about $25,000. Then if you go to SLS, the high end of that is about $46,000. But if you go to residential services or comp, that's the high end of that is $100,000 or more per person per year. That's a really heavy lift for the state. It's not a control for us, because that money then has to go through the state legislature. They have to look at what the financial impact will be for the state to end that waiting list. We have an extensive waiting list. I know there is a waiting list all the way across the state. So I would say the short answer is I don't see much of a chance right now. I don't see a lot of money coming out of the federal government right now. I don't see a lot of money coming out of the state government right now. And when it comes to fundraising, that is a really heavy lift for anyone to put forth $100,000 for the amount of individuals that we have on a waiting list for every year of their life. But the good news is that we continue to work every year, every month, working both at the federal level and the state level to change that. And we work with the other CCBs in the area, and we are doing this on a consistent level. Let me just quickly touch on the second part of this question. Why are individuals coming off the CES waiver at age 18 giving the DD waiver as an option when there are thousands of adults who need it now and are not offered it? And I'm going to hand that off to you, Bob.
Thanks, Melanie. The state made a change several years ago where they decided that they would offer DD residential slots for children coming off the CES waiver. The decision was made, as I understand it, because typically the children coming off the waiver are so impacted so that they are very difficult to manage in the community at home safely. So therefore, it was thought that this was the best mechanism to go. The families have an option of staying in the SLS waiver if they want to, but they also have the option of going into the DD waiver. At the present time, as most people know, the only way to get into the DD waiver, and it's been this way for a number of years, is an emergency situation, which is typically involving something like homelessness, aggressive, dangerous behavior to self or to others, that sort of thing. In order to get a DD residential slot, we have to do an extensive case that has to be sent up to the state and then approved on a case-by-case basis. And we do that, and we've been quite successful for our catchment area of getting emergency placements when they're necessary. Given our druthers, of course, we'd like people to be able to go into the DD waiver as soon as they would like to, once they become 18, since it's an adult program.
Great. Okay, why don't we move on and talk a little bit. I spoke a little bit about this, but we want to talk about how we work through our legislators as well. We become tireless advocates for our individuals and that we work with and our families. And on any given day during the legislative session from January and this year, going through May 10th, we are following any number of legislative bills that are being updated on a constant daily basis. Right now, it happens to be going very, very quickly. I was speaking right before we came down here that half of the bills on this list are already gone. So I did want to point out that we are also working on a study for transportation access for people with disabilities. This seems to be something that is really, really pertinent right now for people. Transportation is such a touchy issue because nothing seems to be working. We can't get payment for Uber, which I know there are a lot of families that are talking about using Uber, but it is not an allowed payment right now. Taxi cabs don't always come. RTD doesn't always work for a solution for it. And individuals that are being served, we understand totally their lives do not go from 8 o'clock in the morning until 5 o'clock in the evening. And they have friends just like everyone else. And sometimes you want to go out in the evening. So we're looking really tirelessly for solutions that will fit everyone's life. And because we are an organization that believes in person-centered thinking and person-centered planning and have dedicated a lot of our time to making sure that individuals within our organization are trained to person-centered thinking and training. We believe that the system should reflect that as well. So we work toward that legislatively as well. Many of the individuals that are within our organization are also serving on committees throughout the state, could be federally appointed. Bob has served on numerous committees. I know Matt right now is currently serving on the Board of Health. I am on the Respite Task Force, so we are really moving ahead. Matt, I thought maybe you could even give us an update on the conflict-free bill that was moving through. I believe you were down there today.
I was. So that's a current bill that was heard in a House subcommittee today, passed 9-0, and is moving on to House appropriations now. It's a bill that we've been working with community partners and other CCBs, provider agencies, membership organizations such as the Alliance Association and others to address what was handed down to the state of Colorado and the rest of the states as a final rule in 2014 that in essence requires that agencies or entities that provide case management to individuals that are on some of the waivers that Melanie was speaking about earlier, specifically what are called HCBS, or Home and Community-Based Services waivers, which are the three primary waivers that Bob's team helps to case manage for. The same organization cannot case manage for the same person that they also provide services to. So for the 50 plus years that our system has been in existence as a community center board system helping to deliver both of those services, many community center boards, most community center boards deliver both case management and direct services to some of the folks that they provide case management to. Bob, I think it's an interesting, as I was listening to you earlier, I think all too often folks confuse a CCB as the sole case management agency and the sole provider agency in the catchment area. Can you give just ballpark, I don't mean to put you on the spot, but about how many providers does the case management group work with?
So we work with, in our catchment area, I believe there's approximately 200 providers that are approved to work within our catchment area. Now there's a smaller number, but at least somewhere north of 100 plus who are actually working with our folks in our two counties. So it's quite a range of providers, and there's quite a difference in their programs, their philosophies, what they do, and it's really important. One of the questions that people have is, what choices do I have? You have a lot of choices, and it's really important to think through who really works best for what you want for your loved one. And work with our case manager and the agencies to try to develop that plan and that life that you really want.
And to the question that was asked before, we've using mill levy dollars have put together a provider a team that is in essence trying to work with current providers, trying to grow future providers, trying to find folks that can meet those needs. Because as we enroll 1,000 new folks in the last few years, all of those people need multiple providers for multiple different needs. And Cindy, in EI, how many therapy groups on average does your team work with?
Within early intervention, we're contracting with more than 400
different providers every year.
Absolutely.
I mean, that's a huge number.
Yeah, absolutely.
So getting back to your question, Melanie, so now the bill will move on, and ultimately if that bill passes and is signed by the governor, then the department, the State Department of Intellectual and Developmental Disabilities, will then have approximately 5 years to help community center boards across the state of Colorado to come into compliance with that final rule, which requires that unless you have a rural exemption, you cannot provide direct case management and direct services to the same individual.
So, and that will directly influence how we do business.
Absolutely.
Here, and for how many individuals?
So of the approximately 7,000 individuals that Developmental Pathway serves every year, Continuum of Colorado, which was prior to 2012 part of the Community Center Board that provided the direct services, that agency serves approximately 650 of the 2,000 or 2,100 folks that is case managed for by Developmental Pathways.
Okay, thank you very much.
Yes, ma'am.
So, any questions? Let's pause here and answer a couple of other questions. And I think I'm going to put Bob a little bit on the spot this evening with some of the questions that are being asked. But anybody can chime in. All right.
That'd be nice.
All right, let's see. Supported community connections is meant to foster natural supports in the community, and my sister has yet to find a program that does this. Can you speak to this?
Yes, I can address the question, and I will say that this is a truncated version, actually, of a series of, I think, about 3 questions that were raised by this person regarding programs that are for her sister. And I will say I have a bit of disappointment that we haven't been able to find that just right program where we're really looking for fostering community involvement and creating a community around this person's loved one. And it's been an ongoing frustration for her. And I can say this, that I think the way to address these kind of things is to work very closely with your case manager to really articulate what we're looking for and where you hope to find it. And if you find your case manager really isn't doing what you would hope they would do, please go up the ladder and talk to the program manager involved, or if that doesn't work, even go up further up the ladder, because we really want to get people satisfied that they have set up a plan that meets their loved one's needs and that it does support community connections and we can create a community for people. I often hear that people will say, I'm hesitant to go to the next level and talk to the program manager or even up to me and give me a call and say, this isn't working for me. But I can tell you with all sincerity that we're really serious about it, that we really want to hear so we can do a better job. And our folks really want to hear too, because we've hired on a lot of new people with the growth of enrollments, and there's been a lot of training done, but there's a lot more training to be done. So these are things that we need to work on. The other aspect of this questions, which isn't there, is that we also work very closely with our providers. And so when we hear that there's a kind of gap that's out there that's not being filled, we meet monthly with the PASAs, those 190 or 160 agencies that we work with. We have monthly meetings and newsletters with them, and we survey them, and we ask them. We say, here's a concern of the community. There's a niche that's not being met. And we say, how do we work together to fill that niche for people? So when we get feedback like this and the question of, it's just not working, we're missing this kind of mid-level person who can't go out and work, it doesn't want to be in a day program, how do we fill that need? And I know there are providers out there who are specializing in filling that need. So we continue to work to create those, but I urge everyone to talk with their case manager in a clear manner so that we don't have miscommunications and we're just not missing what you really need.
And the other commitment that we have made as the largest community center board in the state of Colorado is that if, in fact, in those meetings, what we hear that families want cannot be met because of restrictions at the state level, whether it's based on the plans that we can allow or the way that things can be billed or the way that things can be put together, our commitment as an executive leadership team is to then take those concerns on behalf of you and the folks that we serve throughout our catchment area and express to them why this isn't working for families that are looking for person-centered plans, that are looking truly for choice, and want services that fit their family members instead of trying to fit their family members into the services.
I think I combined the two questions.
Yeah, I noticed. So that's another reason that we are having this forum this way this evening. Not all of our families can find the time to come out to a fun day in the park, can come out on a rainy evening to attend a meeting, to ask questions in person. So we're always constantly looking for a way that we can meet your needs instead of making you meet our needs. One of those ways we felt would be very easy for family members is to be able to dial in and speak to us online and ask your questions and still be able to walk around your house and hear what we are talking about and still be able to ask your questions of us. So let's ask one other question. Which one did you combine?
Yeah, I would go to Colorado.
Colorado, okay. All right, how about Colorado is number 49 in the country for adult services? Why is that when we have the #1 economy and the lowest employment rate? First, let me say that I'm not sure that we're number 49, although there are lots of times that we feel like we are number 49. I haven't seen that survey. That's all I'm saying as far as number 49. I think we may have moved up a little bit, and I'm not quite sure that the economy and the lowest employment rate will affect that. But I'm going to throw this to Matt. How about that?
Well, clearly, That's why Bob wanted you to go to that question, is because it doesn't have Bob's name. Thanks, Bob.
You're welcome.
So I would agree with Melanie. The most recent document that the Coleman Institute publishes, Dr. David Braddock and his team at the University of Colorado, I believe that's right, University of Colorado.
It is.
I always get my CUs and CSUs and DUs confused. But their team at the Coleman Institute puts out a report called The State of the States. And I believe in the last one that was published in 2016, we were ranked 47th or 8th or 9th in overall funding for DD services. But the good news, what's not on there, is the good news is we're rated, Colorado's rated about 11th out of all the states in the metrics that they track in the positive supports and how successful we are in delivering services statewide to folks with developmental disabilities and delays. So the way I read that question is, how on earth are we able to do such a great job as a state with funding that is well below most states? And the answer, pretty simply, in my opinion, is I believe that a politician or would-be politician once said something about taking a village to do something. I would say that it takes a community to do something. And Colorado got it right over 50 years ago when they decided to build a system that deinstitutionalized primarily adults with developmental disabilities out of institutional settings and into their communities. And they did it with the system of the 20 community center boards that exist in Colorado today. It's because we are a community-centered board that allows us the opportunity over the years to build these amazing relationships that we have with our trusted partners like Arapahoe, Douglas, Mental Health, or now All Health, or with the ARC of Arapahoe Douglas, and a myriad of other provider agencies, as Bob and Cindy were alluding to earlier, working very, very closely with our community partners like our school districts and even our judicial system and all of our law enforcement agencies at a local level to make sure that we are doing the very best that we can to champion the best services possible for folks with developmental disabilities.
Thank you. Appreciate that. Why don't we move on to Levy? Thank you. Every year we do a mill levy report. As I indicated earlier, we receive a mill from Douglas County and a mill from Arapahoe County. And to show exactly how we spend our money to both counties, we submit a report in the first quarter of the year, and then we present in person to our county commissioners, two of which serve on our board of directors, overseeing funds as they come in. That mill levy report it has been submitted this year, and we will be presenting to our county commissioners in May of this year. After that that presentation is made, that report is then placed out on our website, and then anyone can go to our website and see the mill levy report. But prior to that, you will be notified if you live in Arapahoe or Douglas County. I'll throw something up in just a moment to show you how you'll get that notification. This year, however, we did a really exciting thing. I know the finance department may not agree with me.
That was exciting.
It came right at Christmas time, but we really encouraged our county commissioners to do what is called an agreed upon procedures audit engagement. And so we really have a baseline to look at, and they agreed to do that. We went through our audit and came out in flying colors with no problems. And I think I'll ask Lloyd, if you wouldn't mind, Lloyd, to talk a little bit about that.
Sure. An agreed upon procedures engagement is an audit process where an outside CPA firm comes in and they examine a selection of transactions. And what they're looking for is proper documentation for the transactions, as well as compliance with what the intention of the funds are. So in other words, if the mill levy contract provides for certain items to be covered, they're making sure that the expenditures comply with the contractual arrangement. And they went through and selected several hundred transactions and didn't really find any exceptions. And then the second area that they focused in on was another contractual term that relates to our management and general expenses. And we have certain benchmarks in the contract that we're required to comply with. And they did an examination of our M&G costs within developmental pathways. And we were within the limits in the contract. So in both of those areas, we felt not surprised. We were pleased with the results. As Matt mentioned earlier, it was started around Christmas time and delivered around the middle of March. And the intent is to do this biannually. And as Melanie said, it was additional work on the finance department's part, and we happily complied with it. But it's something we really welcome because it really set a baseline for us moving forward.
So we work very closely with our counties to make sure that we are reporting out all the information that our citizens need to understand exactly where our tax dollars are going. We feel very strongly that this is our responsibility. And so when our report comes out, if you live in Arapahoe or Douglas County or within the confines of the city of Aurora, you will see in your local newspaper, any of the local newspapers will have a flyer stuck in your paper telling when our mill levy report will be available on our website. We really encourage you to get on our website and look at our mill levy report and see how many people are being served in both counties and where your money goes as a taxpayer.
Melanie, are those stock photos on the site?
No, those are individuals that are within service with us.
Are they?
They are very handsome and beautiful models.
Absolutely.
So part of that report you will see are our mill levy expenditures by percentage. We feel very strongly about staying within our designated funding per contract with our counties. So here you can see that's a very colorful diagram, but case management, community outreach, direct services, admin, and fund balance are all depicted here, and we encourage you to get out and look at it. Okay, we are available for questions again. Okay, should we go to, let's go to,
One just popped up,
okay, great.
the last one.
Instead of paying $100,000 for DD waiver, why doesn't the state give the $1,000 a month to go towards various housing options? I would love to be able to answer that question. I really, I don't believe that I can speak for the state. As I indicated before, we are really not an extension of the state. We are a private contractor. We really just hand out the money. We don't control how the flow of the money goes.
Melanie, you once talked to our staff about, in essence, how it's decided that tax dollars are spent in Colorado with the governor's office, the Joint Budget Committee. Maybe that would answer both of the next questions, this question and that question. Maybe just a general overview of how it's decided, how tax dollars
within the
get spent.
state.
Yes, ma'am.
I could probably do it. The second question is, I do not understand how other states manage to provide funding to adults that support adult living services. Why doesn't our state not have a tax formula set up to address this issue? What can we do to change this? Okay. All right.
In 2 minutes or less. That's the key.
If you can.
It can take one.
It's an important question.
It
It
is an
is.
important.
Right. Well, our state legislature. Okay, let me see. Why don't we? The state. Do I start with the state budget, or do I start?
It's so, I know.
It's very convoluted.
It sure
I'm
is.
trying to explain. Our state budget is really decided. Well, let me back up. Colorado is one of the few states that it's necessary to balance the budget. Let's start there. And each year, the Joint Budget Committee starts in September, coming together to look at the amount of funding that is available within the state that is non-encumbered funds. There are the greatest amount of the state budget, and I believe, if I'm correct, about 73% of the state budget is encumbered already through tax measures that have already been put in place for education, for everything, including the TABOR regulations that are out there right now. And the only amount of money that is left is about 20%, and there is general fund money that is in there as well. That amount of money then goes to the Joint Budget Committee that then looks at the amount of money, and they shuffle through everything else the state does to figure out which department will get how much money. That really becomes a problem when you're trying to balance the budget with all of the needs that are out there. So there's a program that all of you could go to out online that's called Balance the State Budget, I believe, that you could go and start to play that when you remove money here to pay for the DD waiver and move $1,000 a month for every person that you would have to pay for the DD waiver, then that money comes out of education. Or where are you going to take it out of to pay for? So we actually had individuals come in and sit down with our staff and look at how do you do that. It's the same with your household budget, and how do you balance that whole budget. So I'm sorry, that's really kind of how do you play with the budget.
I think that's exactly I mean, that's a fantastic answer. That's the problem in essence is
It is.
To give more to one program means
Let's
less to
take it
another.
away.
And if I could add on to Melanie's aspect there, that a lot of what we do in case management is triage difficult situations because of fiscal constraints. And over the last year, we've set up a crisis group just to deal with crisis situations where people are really in dire straits, to move as fast as we can to get the resources necessary to help those folks, because it becomes an overwhelming problem for those individuals and their families, and also for the system. So that's been one of the ways we've dedicated our resources here at Pathways for our communities to try to deal with some of the triaging that has to be done because of fiscal constraints.
Thanks, Bob.
Mhm.
So, and one really quick question that just popped up before, because we have just 2 minutes left. Is the mill levy permanent? Yes, it is. It is in perpetuity. So I think we will stop there. And thank everyone that has signed on with us this evening. I can't tell you how much I appreciate it. We hope that this has worked. If this has worked for all of you that have joined us this evening, we truly hope that you tell other people. And we would love to be able to do this again next year.
Will this go on the website?
Yes, it will. Thank you for saying that, Matt.
Excellent. Just want to make sure. dpcola.org.
That's it.
Love our
Thank you.
website.
Yes. That's dpcolo.org. All right. Any last words from anybody on the panel?
Thank you.
Thanks to the
Thank you.
team that helped to put this on.
Thanks for the team.
Yes.
We have a lean, mean team from IT and communications that have done a terrific job of putting this on for us. So.
That have had a really hard time being very quiet.
Not one sneeze the whole
But
time.
have succeeded.
That's right.
Yes. Thank you all very much.